It's another Wednesday with your fertility specialist. On behalf of House Hospitals, we love to say a very big thank you to our dear viewers. Thank you for liking our post. Thank you for always staying glued to your screen. I'm one of your hosts, Ruth Ogogo, and it's a pleasure to be with you guys this afternoon. Okay, so for those of us that have seen the flyer, we're talking about young girls with premature ovarian failure. So, yes, if you're a mother, this is for you because you probably have daughters. If you're a young lady, this is for you. So, right now, as we get started, please share this link with as many people as you can. Yeah, it doesn't mean a man cannot also join this. Please, a man could join this. As a matter of fact, all the men are invited to join this chat right now. Feel free to drop your thoughts, your comments in the comment section as we start. And guess who we have with us today? We have Dr. Kenneth Iguda. Dr. Ken, it's good to have you. So, for the sake of someone watching, just a little about Dr. Kenneth. He's a consultant gynecologist, he's a fertility specialist, and one of the best IVF specialists, as a matter of fact. He's also the first to have pioneered laser gynecological surgeries in Africa. So, yes, that's just a little. There's a lot more to him, but we'll stop there for now. Yeah. So, Dr. Ken, today we're talking about premature ovarian failure in young girls. And it's worrisome that, yes, even though the statistics seems to be a bit low, but I'm sure since it's your field, I'm sure there's a lot of data not recorded. And with your experience, I know that you might see this as something that is becoming common than it used to be. So, well, for the sake of people watching, before we talk a lot about it, maybe you should tell us just a little about what it is so they even understand what we are talking about.
So you use the word premature ovarian failure, and I think the word is explanatory enough.
Okay.
It just means the ovary has failed before its usual or normal time of supposed failing.
Feeling. Okay.
you know. So, though the word used currently to make it a little bit decent is premature ovarian insufficiency,
Efficiency. Okay.
but in any case, they mean the same thing. The signs and symptoms haven't changed. It's
Change.
just a word to make it more friendly to the ear, even though the condition itself is one of the most devastating condition. I mean, to a young girl.
No.
So it just means the ovary having a cessation of function
Wow.
before the age of 40. That's the standard definition of what it means.
Okay.
So the ovary stops working before that time,
Wow.
you know. So that's premature ovarian insufficiency or failure. And now, when you use young girls, now I really don't know
Yeah.
what you mean by young girls, but I want to assume that there are people not even close to 40,
40. Yeah, exactly.
and then they have problems with ovarian reserve, and the
Yeah.
ovaries are not performing. They practically have failed. It means there are no eggs, and already menstrual flow or menstrual rhythm or cycle are already been affected, and the changes associated with menopause, it's already taking its toll on these categories of people. And then for those who want to demand make demands of their ovary to produce eggs
Yeah.
to achieve pregnancy at that stage, they won't be able to achieve any results. So premature ovarian failure just means a cessation of ovarian function before
Function.
the age of 40. It could be at
Wow.
20,
Oh,
could be at
wow.
25, 30, up onto 40. Because regularly the function of the ovary um, you know, starts from around that mid 40s.
Okay.
I mean, starts failing from around 40, and by 50, 52, a woman is menopausal. But for those with premature ovarian failure,
Failure.
menopause just happens.
Wow,
You
like
know,
at
you
a
can
very
imagine
young age.
being menopausal by the age of 22.
Wow,
The youngest I've seen is 20.
that's worrisome.
Yes, I've seen
My
a girl
goodness.
20 with the
Oh my
premature ovarian failure,
goodness.
and it was devastating having to have that discussion with her parents and I
Hmm.
and myself in the consulting room.
Wow.
Yeah, so I guess in a little time we'll talk about that.
About
But
that.
that's what premature ovarian insufficiency or failure is. Ovarian activity function ceasing before 40.
Oh yeah. So dear viewers, Dr. Ken has made us to understand that. So it means based on what they have in the books, if someone is up to 40 and they start experiencing it, you wouldn't call it premature failure. If each now that person is more like tending towards
Of course,
menopause.
for those of us who are reproductive specialists, for instance,
Yeah.
we see women a lot in their 40s. We know that at that age, there is nothing much
Much.
that the ovaries can produce. If a woman is trying to get pregnant with her egg at the age of 40, you just about 10 to 15% chance of succeeding. Of course, then you see women do fertility treatment, for instance, IVF, and it doesn't fail, and everything seems to be fine. They come tell you that everything is fine, and why should I just not succeed?
Succeed.
Everything is never fine in the first place. 40
Mm.
is not fine.
Mm. But they say life begins at
Yes,
40.
life begins at 40. I mean, maybe business life, but reproductive life drastically begins to fall
Oh,
or deteriorate at 35
wow.
for the normal population of women.
Women.
And
Okay.
at 40, it's already badly deteriorated. At 44, it's almost gone. And then 46, 47, when a woman has 1% chance of getting pregnant with her eggs, with a high chance of having abnormal babies,
Yeah.
ovarian functions with respect to production of eggs
Eggs.
and the capacity of the eggs to produce pregnancy has already deteriorated.
Wow.
Though a woman can continue to have some form of ovulation, but the qualities may not be good. She could have estrogen, progesterone to still keep her, maintaining her normal
Wow.
hormones of a woman, but
Yeah.
it doesn't mean that
That
she is
she's
reproductively viable at that
at that
point in
point.
time
Wow.
with her own eggs.
Eggs. Okay, so viewers, I know that this goes on, I know you will have a lot of questions in your minds that you would want to deal with. Please keep your questions coming, and we'll definitely attend to them. Okay, so now it's really worrisome because now I heard you say you've had to deal with someone that was 20, and I'm
Mhm,
like, what's really the cause of this? Because such a young girl, it's worrisome
mhm,
that
mhm.
at this age she's barely in her parents' house. I mean, I can imagine what
Yeah,
really
yeah. Her
it's the
situation, her
cause.
situation was this. She's small sized. Of course, she looks normal. And I think her mom just dragged her to the consulting room. She had seen some gynecologists before who just told her that she has thinned out endometrial
Emotional
lining,
learning.
and I go see Dr. Ken. You
Yeah.
know, so I was just wondering. So, but reviewing her, doing all her hormone profile, you saw that this thing had actually been knocking around because she just at before 20 she goes 6 months without menstruation,
Wow.
you know and then it was like nobody really cared about it, you know but usually when women don't see their menses they start getting worried. She was
Worried.
worried, but not big enough to warrant so much. So reviewed her. All her hormones were abnormal. Those that are meant to be very high were
Hi.
very high. That's the luteinizing hormone. The follicle stimulating hormone were extremely high.
Hi.
Then the anti-Mullerian hormone was
Oh my goodness.
extremely low. That means the ovarian functions were bad.
Bad.
Then, of course,
Oh.
when you do ultrasound scan, you see that the uterus has shrunken in size, and the ovaries were very tiny at that age. And they needed to know what the diagnosis is. And then, of course, it was premature ovarian failure. Oh, you know
Wow.
what that means? That even at the age of 20, you can't make demands on those ovaries to produce
Yes.
eggs.
Oh
So
goodness.
she is automatically going to be needing egg donation if she wants to get
Hmm.
pregnant. Of course, except if you do premature ovarian, ovarian rejuvenation, because
Rejuvenation.
these categories of people respond uh, better
Oh,
doing
okay.
ovarian
Ovarian
rejuvenation
rejuvenation.
using either mesenchymal stem cells or platelet rich plasma
Hmm.
or some adipocytes based stem cells or growth factors.
Hmm. So, what do you think? Are there some lifestyles that actually predispose people to this, or is there a basic cause of this, like over time, based on your experience and research over time? Is there a basic cause, or are there some lifestyle that people engage in that could actually predispose them to this?
Yeah, there are lifestyles and there are other things that could predispose people to having these. Usually it may be genetic,
Okay.
you know,
Mm,
and there are genetic conditions why women could have this.
mm,
One, there are some syndromes like Turner's, a syndrome we call Turner's, which is where there's an abnormality with the X chromosome.
okay.
So you're born as a woman, you're a
Mm,
woman, you menstruate at the regular time,
yeah.
and then you could actually be ovulating,
Mm,
but the ovaries reserve it's
it's very
extremely low
low.
at that
Okay.
point in time. So you don't have
Wow.
long time for
Time.
fertility.
Mm,
And you could see now before you get anywhere, everything is gone.
mm,
So you may stop menstruating. So
mm,
during the window of not having normal menstruation, you could actually ovulate and have eggs and get
mm.
pregnant.
Okay.
You know, check out the breast of this lady. The breast looks okay.
Mm,
I mean, it's well developed,
yeah.
but then the uterus have no sensation. No response to stimulus, and so
Wow.
they are becoming small in size, ovary small in size, and all of that. So genetic conditions like
Wow.
Turner's,
Mm,
then autoimmune conditions, for instance, when there
okay.
are antibodies, the body produce antibodies against the ovaries.
Okay.
Then
See.
they attack the ovaries
Mm,
and cause accelerated depletion of the reserve.
mm,
So those are some genetic conditions. Then you could have when you're talking of lifestyle,
yes.
you could have smoking, for instance.
Oh,
And yeah,
wow.
smoking
Mm,
and consumption of some illicit or recreational drugs could affect the ovary negatively,
okay.
and then it reduces the lifespan of the ovaries,
Ovaries.
and so
Oh, I
you could
see.
get into premature menopause a little earlier.
Wow.
You have some treatment,
Okay.
even the environment to live. Let's start from the environment.
Environment.
If you
Mm,
live in a radiation prone, environment,
yes.
you never tell the amount of damage radiation does to the body.
Mm,
That can affect glands in the body,
body.
including
Okay.
the ovaries as
Mm,
an organ. So you have medicines,
okay. Some drugs.
some
Wow.
drugs,
Mm,
you know, the drugs used to treat cancers, for instance,
mm,
chemotherapy, then the radiotherapy, they could cause ovarian failure.
wow. I
You
know
know,
sometime back you talked about cancer and how they can preserve fertility.
exactly. So
Wow.
they can cause ovarian failure,
Mm,
premature ovarian
failure.
failure.
Wow.
So chemicals,
Okay.
agroallied chemicals, for
Chemicals.
instance,
Wow.
or
Mm,
some other kinds of chemicals that are toxic to the body could cause premature ovarian failure. So those are
a
some few
lot.
things I could talk about on
Relate.
this platform.
Wow.
You
So
know,
it's so dear viewers, Dr. Ken has told us a lot about some of the causes and yes, what really interests me is the genetics. Sometimes you really don't know which of the genes can actually predispose you to these things, but we can only hope that we all have good
oh,
genes, but
sure,
we never know what can trigger something that
that's true.
could result to one of these things. But it's worrisome, and we really don't know how this is because it seems to be getting on the increase. Like it's not before we hardly would hear about this, but now it seems to be getting slightly common, like more common than it used to be. So it's
It's expected because
hmm,
lifestyle has actually changed. We are
over
in a very
time.
advanced technological age at this point in
Yeah,
time.
that's
A
true.
lot of radiations that we don't care about. A
Hmm,
lot of addition to our body in the form of
yes.
cosmetics and all of that. Then of course infection. Sorry, we didn't mention infection. Yes, a
Wow.
lot of infection can cause that.
Okay.
And some surgeries could also lead to premature ovarian failure. You know, for instance, I'm a reproductive surgeon, I'm a gynecologist,
Yeah.
even the technique of operating a woman sometimes
Hmm.
can
Wow.
lead to premature ovarian failure. For instance, we are trained as reproductive surgeons
Yeah.
when operating on the reproductive organ
Yeah.
to try as much as possible not to cut across
Hmm.
blood vessels. You
Okay.
cut along blood vessels because if
Hmm.
you cut across, you damage the blood vessels. Your surgery may be beautiful,
Oh wow.
but the
Of
the,
course.
the, the effect
Yeah.
may be negative. So if you have a habit of cutting across blood vessels, for instance, you are going to affect the blood supply to the ovaries, and then reserve goes down, and it's going to affect the length of reproductive life. I mean, with respect to eggs.
Yeah.
So the
Wow.
technique of surgery. So it's not enough to just operate and come
Wow.
out, but surgery is beautiful if you operate and the woman is safe and you maintain the viability and integrity of the organ you operate on.
Praise
That's when
God.
surgery is successful. So the
Successful.
style of surgery, the technique of surgery,
Surgeries.
and the knowledge of physiology and
Hmm.
approach to surgery may be very important when
Wow.
operating. So surgical techniques could affect ovarian life.
Life. Wow.
Yeah, yeah. So these are
Hmm.
some causes.
A lot. Wow. A lot. So there's a lot. Okay. Yeah. So while we're preparing for this, I actually saw that they said that the life expectancy actually for those with premature ovarian failure declines by 2 years, and it's worrisome. So
Mhm.
like you like I said we were going to ask you what you think based on your experience with regards to this finding over people that have premature
It's
ovarian
not
failure.
strange to associate premature ovarian insufficiency or failure
Yeah.
to decrease or reduce life expectancy.
Hmm.
Because in the first place, if you have this diagnosis, you are depressed.
Hmm.
Also, these diagnoses come often when you make demand on the ovaries.
Ovaries. Oh, a
And that
lot.
is why you often make these diagnoses on young people
People
when they're trying to get pregnant and pregnancies
pregnant
are not coming forth.
coming.
So already there is a negative effect on
Effect.
your mood and emotions.
Wow.
Depression and negative effects of this have a negative endocrine effect, negative hormone effect, and it decreases your lifespan. You can imagine the lifespan of somebody who is happy, all things being equal, is going to be longer
Longer.
than somebody who is on the negative side,
Side.
depression
That's
and all of
true.
that. That's one. Secondly, the hormones of reproduction, the estrogen and all of that,
Yeah.
are aesthetic hormones. So they
Okay.
keep the functions of the body, the bones, the
Yes.
muscles, and all of that for a relatively longer
Long
period.
period. Okay.
You could imagine that you start having negative effect of hormone because of failure from the age of 30. And meanwhile, regular women get to 52 before they
Can
start
you
having
imagine?
negative effect. So you're
Yeah.
exposed to a lot of hazards,
It's true.
cardiovascular problems, you know, and then than those who are normal. So all of
Yes.
these are negatives. It can only affect life expectancy of
Wow.
those who have premature ovarian failure. Because premature ovarian failure comes with muscle problems,
Oh
comes with
God,
bone
it's a
problems
lot.
because the bone doesn't metabolize adequately,
Mm.
especially among those who do not have the privilege of having a hormone replacement therapy.
Yeah.
So they have negative effects on all these organs. Heart problems may even
Mm.
be
Yes.
common,
Then.
and so before you know, it's okay. I mean, it's just bad.
Yeah, really, it's really bad.
It's
I know,
bad.
okay, now that you're really talking about this, I know some viewers are worried. Hope I'm not having this already. So, are there things that they should actually look out
I
for?
I, I know a woman.
Hmm.
One of the women I've seen before. I don't know in which country I've dealt with that. I guess one of the countries in Europe
Okay.
during my period of working
Yeah.
around those regions. The mother told her daughter that be careful. My ovaries stopped working when I was 40.
Hmm.
Try everything to make
Yeah.
sure you don't need those ovaries by 40. Yes. And at 40, around that, getting to 40, her
Yes.
ovary stopped working. I mean, it
Wow.
failed.
Yeah.
You understand? So it could be a genetic condition transferred from a parent to
Yeah.
her offsprings,
Hmm.
and some of these genetic characters are selfish genes. Selfish genes means that they perpetuate themselves. I have it, my next generation
And
has it,
yes, like
the
it
other
keeps
generation have it. It
like
doesn't just keep, so it just goes. Some of
yes.
these genetic characters are selfish, so they just
Hmm.
transcend generations.
Generation. Wow.
So what the mother was telling her daughter in a crude way was that get pregnant as soon as you
Yes, you
can,
can. Wow.
you know,
Wow.
because it happened to her, so it could happen to
So
you, so
exactly.
that was it. And it happened.
Wow.
And so it could just be like
Be
that.
like that. So if just that's why sometimes it's good some of these histories from your parents. So you find
Hmm.
out from your mom if she says
Hmm.
she's no longer seeing her period. When did it stop? Maybe just maybe that could
And that
guide
is why
you.
sometimes when you see people say, ask you whether you have a family history of this, say, God forbid. You can't forbid it because
Yeah.
it's already in you.
Hmm.
It's genetic. Like begats
Like
like.
that's true.
So you can't forbid it.
Yeah.
Just prepare for it. It's just like my mom is diabetic, for
Oh
instance.
goodness.
And I know that it's a matter of time.
You might be lucky.
I pray I'm lucky. I may just be hit by it. That's the reality because these things are
Yeah.
genetic. Okay. Of course, inherited the genes from your parents. And
Yeah.
sometimes you may have two bad genes from
They
coming
come
from
from.
a
Oh
parent.
goodness.
And so your own future may be worse than your parents with
Oh
respect to
goodness.
health.
Yeah.
So when I see my mom, I remind myself that, hey, Ken,
Hmm.
just be a bit careful. Your mom is this, your mom is diabetic.
Hmm.
Yeah, she's managed it well. And so just watch it.
Hmm. Keep yourself in check. Oh yeah. So
And if my mom is listening to this, please don't be angry. You are my mom.
okay. So yes, I know that earlier on you said some things that people could look at. Maybe you should just restate some things that people could look out for that would guide them to say, okay, aside the gene now, because you've mentioned about
Mm.
just in case, but are there things that they possibly see that will make them know that you're likely getting to this point? Maybe you should see a doctor or something just before it gets really bad.
Yeah, I think the first sign is maybe you observe that your breast size is getting smaller.
Hmm.
Yes, because the breast is sustained by the hormones you produce during your
Okay.
active menstrual cycle.
Yeah.
The estrogen and the progesterone, and that is why you see at some point during the menses the breast gets turgid and then heavier and
Hmm.
painful. Then it goes
Yeah.
down again. When you observe that those changes are not happening,
Yeah.
and then you're
Hmm.
not done with your reproductive life,
Life. Hmm.
or just for curiosity, it's okay to
Yes.
check.
Hmm.
But I think the one of the important ones is maybe when you realize that your menstruation begins to skip unnecessarily.
Hmm.
Now, it doesn't mean that when your menses skips is
That's
premature
it.
ovarian failure.
Hmm.
There could be other things
It could
responsible
be.
for that. Okay,
Yeah.
it could be polycystic ovary,
Okay. Hmm.
and then we have, if for polycystic ovary, you have all the signs of polycystic ovary. You may be having facial hair like guys, mustache, then the side bugs, then acne,
Hmm.
abnormal male pattern of hair,
Hair and all
and
that. Okay.
then no menstruation for 3 months, 4 months, then it comes and all of that. So it's good to check up with the doctor,
Hmm.
but then premature ovarian failure just shows with no menses too, and it can
Hmm.
last for a long time.
Time.
Sometimes
Wow.
you can be 1 year without menses.
Hmm.
Then when the menses come, it just comes little.
It's wow. Hmm.
The pattern of comes point heavy and refusing to stop.
To
Then
stop.
it goes away for 2 months
And
without
it
seeing.
doesn't
So
come.
that's one pattern. So you need an expert to evaluate and tell. Of course, then the tests.
Hmm.
You scan a 20-year-old girl,
Hmm.
you see that the ovaries are small,
Small. Hmm.
then the uterus is also small in size,
Oh, good.
and then she says she's not menstruating.
Hmm.
Meanwhile, she started menstruating early, maybe around 10, 12, 13.
All that.
And also
Hey.
know that then you do your hormone analysis, then the hormones are on the high
High
side,
side. Wow.
and then of course you see these are telltale signs of
Of
premature
that.
ovarian failure.
So is there really a cure for this? Because now we're talking about a young girl. It's not easy to just tell a young girl that we think it's donor eggs. Do they have? Is there a way, or is there an extent that you say, okay, this can still be remedied, or there's an end stage that is okay, nothing can really be done. You just have to take egg donation.
Oh well, remedy. Now, I'm not the best person to be asked this kind of question,
Okay.
whether it can be remedied, because I believe I think a little bit weird that everything has remedy. One, you could do an ovarian transplant,
Okay.
you know, depending on the cause of the ovarian failure. An ovarian
Failure.
transplant can be done. Now, if a woman sees that she has this kind of condition and it caught early,
Yeah.
you understand, you could do take part of the ovaries and
Okay.
cryopreserve,
Okay.
and then it can be used later,
Oh wow.
actively when she needs them.
Mm.
Or you could treat her and get her eggs if she's not ready to get pregnant. If she
Yeah.
then preserve the eggs,
Mm.
and then she uses it later, even when she's failed already, when the ovaries have failed.
Yeah.
Then, if you have a habit of doing gene analysis for humans, for instance, you could do a gene profiling of this grown individual.
Okay.
If there is a suspicion of that,
Okay.
especially if the parents have had it, a suspicion of that, do and see whether she
Wow.
has it. So you
Okay.
could prepare to delay ovarian aging for her, you
Hmm.
know, or you find a way to get her eggs to
To
keep.
keep.
You understand? Then you can do a gene editing for such an individual.
Okay.
Yes, please.
Hmm.
So you could do gene editing for such an individual, and that's why I say I'm not the best person to ask this
At
kind of,
all.
because I'm not likely going to answer the regular way that
Wait.
people.
Hmm.
Otherwise, I would say it has no cure.
Hmm.
But in today's world,
Anything
everything
is
is
possible.
possible. You could change if it's an abnormal gene she's having, for instance. You could change the genes.
Oh wow.
Yes, please.
Okay.
You could change the gene. After all, we measured Turner syndrome, right?
Yeah.
Recently, there was a release of document stating that a baby born with Down syndrome was
Hmm.
cured.
Wow.
You understand? And
Hmm.
Down syndrome is an abnormalities that happen when aging eggs, or bring about
Yeah.
pregnancies,
Yeah.
cured by CRISPR.
Hmm.
So even so, premature ovarian failure as a result of genetic disorders
Yeah.
can also be cured.
Cured.
That is my point of view.
Yeah.
And then, but with what is available in the environment right now, is just to take the eggs and freeze.
Okay.
Then, if they make demands on pregnancy and it's not feasible to get them pregnant, then you could do ovarian rejuvenation,
Okay. Hmm.
using precursor stem cells or
Okay.
mesenchymal stem cells or
Hmm.
adipocyte stem cells and all of that. Yeah, we do two of this type here. In fact, I remember when we did ovarian rejuvenation for a 27-year-old lady
Yeah.
who got married quite early and
Hmm.
had a child, and
Hmm.
then 7 years had passed. There were no children anymore
Children.
coming,
Wow. Hmm.
and then the hormones were just in the skies.
Hmm.
In fact, when you scan her, you can't even appreciate the ovary. You have to be
My
very good with
goodness.
ultrasound scan.
Wow.
The ovary was just like was just
Hmm.
streak ovary. I saw that ovary,
Hmm.
and then we did ovarian rejuvenation using the precursor stem cells, and growth hormones as additives. At that point, then we proceeded. That's after she's gone a lot of places for IVF,
Hmm.
and they were not succeeding in getting
Succeeding.
eggs.
Wow.
We did that for, I think, that was when we started ovarian rejuvenation,
Okay.
like 6 years ago,
Wow. That's a long
and it
time.
was I think our first pregnancy with ovarian
Wow.
rejuvenation like six
Wow.
years ago.
Okay.
So we did that, but it was premature ovarian failure at the
Failure.
age of 27.
27. Hmm. Whoa.
You understand? So
When a woman is supposed to be like at her peak.
yes, we've written a paper
Hmm.
on that already. You
Wow.
understand? So those are some ways to manage them. It depends on what it is, but you could manipulate it. But for those for whom pregnancy is not an issue,
Yeah.
it's hormone replacement therapy
Therapy.
that you may
Okay.
have to embark on. And there are diets that helps with with the hormones changes,
Okay.
you know, diets that are phytoestrogen based diets, you know, then hormone replacement therapy. So it supplies the hormones that the ovaries is meant to be supplying
Yeah.
to the body for normal functions of the body. So this is what I would like to say maybe the cure is. Then of course pregnancy is also possible with egg donation.
Okay.
Egg donation.
Mm.
Yes, egg donation. So those are some of the ways I can talk about the
About it.
cure.
So
I'm
I'm.
going to be talking about I'm going to be talking about reproductive health
Okay.
and gender empowerment.
Okay.
You know, yes, in one
Mm.
of the biggest what do you call this
Platform.
institute
Okay.
of policy making
Wow.
in
Mm.
Africa
Mm. Okay.
tomorrow.
Oh
You
wow.
understand? And this, I'm not talking about the current things. I'm talking about
Yeah.
the future.
Mm.
And this is only going to be appreciated if you have a government that cares about reproduction. As I speak to you, I've said it before that in some European countries, when girls are born,
I was just going to ask you
okay,
because I know you remember.
ask it.
I remember when I was just going to say you should talk about it because I remember I know there was some
Hmm.
time you
Yeah,
talked
yeah.
about it
Hmm.
that there was should I say there are some countries that do
Uh-huh.
that. So I was
Hmm.
just going to ask what your opinion was about that.
Yes, I feel that you should know what your capacity. Just like, is it fortune telling? That
Oh yeah.
you do a fortune telling on the genes, right?
Mm-mm.
A fortune telling on the genes. You know, you do an analysis of the genes, so you'll be able to tell what's the expectancy of
Like the
this lady's
forecast.
the focus of this
Mm.
reproductive life is, and then you
Yeah.
advise the person. And then
Mm.
there are companies or organizations right now in the world that don't just do on the ovaries; they
Mm.
do about every aspect of your life,
Wow.
about how your heart is going to be functional to what
Hmm.
length, what
Hmm.
state, what kind of illness you expect to have at so
So
time,
time.
so you
Wow.
can put
That's a
yourself
lot.
together and see if there are ways to overcome it. So it's a world of genetic medicine right now. And
Mm.
for me, as a very young child, I mean young adults
Yeah.
in France, then I was walking along an aisle and I saw a big caption on the wall. It said, "In the future, our DNA
Hmm.
will be our identity."
Oh
At that point, I
wow.
was a young doctor, but of course, I was already making my incursion into reproductive medicine.
Hmm.
I didn't know the depth of what that meant, but today we are living in that future, and we're
Yeah.
looking forward not just to that capacity now, but how to even make life without humans'
Humans.
involvement.
Hmm. Then how will you see the relevance of humans?
Oh well, they'll
Because
still be
we're getting to the
relevant.
point of AI now. AI taking over everything already.
Yes, the scientists from Cambridge, have a
Yeah.
publication. I mean,
Hmm.
a documentary some weeks ago in
Hmm.
BBC, and they were like, okay, now we've unraveled all the capacity of the human genome, and get ready, we could just make life without humans. I just love that. I guess you're a Christian.
I don't care.
That's not good. Yeah, all right. Life is life.
Oh yeah, life is life. Okay, yes. So you've talked a lot about premature ovarian failure, and I know that our viewers have heard a lot about premature ovarian failure. What could likely be the cause? What could pose you at risk?
Yeah.
Some of the signs you see and possible ways that it could be cured in a way. Yeah. So just a little counsel to people out there on how, because I know sometimes some people even would ask, are there medications that I can take to prolong my my fertility? You get that a lot of times. You hear a
Yeah.
lot of people
Hmm.
say, okay, what can I take to prolong my fertility and all of that. So what would be your counsel to people generally, since we're talking about its impact on fertility with premature ovarian failure?
Or you don't really understand, make sure you make a consultation with not just a gynecologist, but with a reproductive gynecologist, or
Yeah.
yeah, a gynecologist with good knowledge of reproductive endocrinology.
Hmm.
So your life will be put in perspective, because you see, in this part of the world, people don't interpret their symptoms appropriately.
Yeah.
Yes, and then they
You're
just live with
wrongly
it. And
diagnosed.
a woman stays, for instance, and thinks because she's menstruating, she's okay,
Yeah.
and
It's true.
everything is still
It's
fine, even when
fine.
she's 50. Take your symptoms seriously, and if you have gray areas you need some talks on,
Clarity.
you see the doctor. Yeah, I think advice I can give, but it's devastating to
Yeah.
be labeled with the diagnosis of
That.
you know I could see a lady. I saw a lady some time ago, with premature ovarian failure. In her case, she was getting pregnant, but she was having frequent
Miscarriage.
miscarriages.
Oh, wow.
Young lady. So it's wondering what's causing these frequent miscarriages. Just for some people, it could be frequent miscarriages.
Hmm. Wow.
Exactly, because before the ovary fails, the leftover egg, the eggs you have left will have been
Quality.
poor qualities. So it could present as frequent miscarriages.
Miscarriage.
So when
Wow.
we did the hormone analysis, the uterine, very pretty
Oh
lady.
no.
Well, personally, I can't imagine that she
She
had no
had
eggs to
that
have
exactly.
babies. You understand? So
No, no,
it
beauty.
was a painful diagnosis, even for me. And when she left my office, she came back. And Dr. Ken, you mean this is what I have?
Oh no.
At that point, it was so emotional. I felt like shedding
Yes.
tears, but I'm the doctor, and
So
I
you
have
have
going
to.
to have to tell you what
Yes.
the diagnosis is. Yeah. Some of the doctors saw it, but didn't make
Attribute
a
it to that.
headway with the diagnosis.
Yes.
But that's what the diagnosis is. And then, well, I can imagine that she would have to knock on the door for egg donation,
Donation.
or some other
Exactly.
advanced modalities of
Modality.
reviving or rejuvenating the ovaries. And by the way, ovarian rejuvenation doesn't mean the ovary is back to
Back.
perfect and normal.
Exactly.
Let's not paint a picture that is not
Not
real.
real. That's
It
true.
just improves your chances of getting your egg by some means, but not eternally.
Well, so there's just a lot. I really wouldn't know if we have someone that's battling with that right now. But if we have someone right now that's watching and you've been diagnosed with that, I think maybe you should seek help from the right place and let the best of counsels be given to you, proper evaluations be done. And we hope that somehow, some way, you're able to achieve what you intend to achieve in the midst of the diagnosis. But then it's good that, like Dr. Ken has said, do not play with symptoms that you see. Do not just assume it's normal, or do not assume because your friend is experiencing this, it's
Yeah.
possible that that's what I'm actually going through. Please be sure to see a very good fertility specialist so they are able to attend to you appropriately. Once again, you could still book an online consultation just in case you are not able to reach us at our centers, apps, hospitals, just or whichever of our centers. If you're unable to reach us, you could actually book an online consultation to start from there before we have a physical consultation with you. It's been good having you, Dr. Ken.
Anytime.
Thank you, dear viewers, for keeping us. Yes, you're the ones that actually kept us here. So thank you for keeping us here today. It was good to have you, our dear viewers. Stay tuned. You just continue to stay glued to your screen as we keep more and more sessions coming your way. Have a lovely evening. Bye.
Cheers, babe.